Retatrutide dosing is stranger than anyone explains. You do not start at the dose that works. You climb to it. 5 months, 5 different doses, and every time someone tried to skip a step, their side effects nearly doubled. This is the part of Retatrutide almost nobody covers. First, the basics. Retatrutide is a shot, not a pill. Once a week, same day, under the skin, same family as Ozempic and Mounjaro, just stronger. And like its cousins, you do not walk in and take the dose that does the work. You start small, you creep up. That gradual ramp is called titration. Why the slow climb? Because researchers found out what happens when you skip it. A few years back, they ran a test. Same target dose, 2 groups. One started at 2 milligrams a week, the other started at 4. The higher starters had nearly double the nausea, vomiting, and diarrhea. Same destination, very different ride. That finding became a rule. Every trial since begins at 2 milligrams. So here is the climb. Weeks 1 through 4, 2 milligrams. Weeks 5 through 8, 4. Weeks 9 through 12, 6 milligrams. And 6 is a new step. Earlier trials jumped straight from 4 to 8, and people told researchers the jump felt awful. So a stair was added. Weeks 13 through 16, 9 milligrams. From week 17 on, the full 12 milligrams. 5 doses, 20 weeks. 4 weeks at each step. Why 4 weeks between every step? Because the drug needs time to settle. Retatrutide sticks around for about 6 days after each shot. That is its half-life. When you take your next shot, half the last one is still in you. It takes roughly 4 weeks of steady dosing before drug levels stabilize. Move up faster than that, and the old dose is still stacked under the new one. Now, what does each dose actually do? In an earlier trial, people at 1 milligram, the lowest, lost about 8.7% of their body weight over 48 weeks. At 4 milligrams, about 17. At 8, 22. At 12, 24. In the biggest trial since then, running 68 weeks, the 9 milligram group lost 26.4%. The 12 milligram group lost 28.7%. More dose, more loss, up to a point, which brings us to the reason not everyone lands at 12. The top of the ladder costs something. At 12 milligrams, about 21% of people developed a side effect called dysesthesia, a tingling, pins and needles feeling, usually in the hands or feet. At 9 milligrams, only about 9%. Dropping out of the trial also went up, 18% at 12 versus 12 at 9. About 2 extra percentage points of weight loss at the top, for roughly twice the tingling. That is the trade. One more thing most people miss. The ladder runs in both directions. If a patient loses too much, BMI drops below 22, the protocol says step the dose back down. Below 18.5, treatment stops. Nobody's supposed to live at the top forever. You climb up to reach your target, then you walk back down to hold it. Everything you just heard assumes one thing. A shot once a week, same day, 7 days apart. Every Retatrutide trial has used that interval. Nobody has tested splitting the dose. Nobody has tested every 5 days. Any other schedule is outside the data. So where does this leave you? Retatrutide is not FDA approved. It is investigational. Only people in trials have legal access. And even when approval does come, the dose on the label might not match what the trials used. Doctors might get room to park patients at a lower step, or the label might pin everyone to one target. That decision is still months, possibly years away. Every dose, every trial, every source is at glp3.wiki/articles/dosage. Retatrutide is not FDA approved. This is information, not medical advice. If you are thinking about GLP-1 medication, talk to a qualified healthcare provider.